We now have two approved agents in the United States that are targeting PD-1. They're both antibodies in recurrent or metastatic squamous cell carcinoma of the head and neck. The first is pembrolizumab. That was the one that garnered approval first, based on non-randomized data. These are data from an expansion cohort of patients with recurrent or metastatic head and neck cancer. Many of those patients were refractory to therapy, including refractoriness to platinum and cetuximab. Compound that with a second study called the Keynote 055 trial that specifically enrolled patients who had been platinum and cetuximab refractory. And we now have a data set that is over 150 patients, clearly demonstrating that pembrolizumab is active in these patients. Response rate in the high teens with a very promising median overall survival, 1 year survival somewhere around 40%. Nivolumab, the second agent to get approved, only a few months after the approval of pembrolizumab, was approved on the basis of randomized data. This is the Checkmate 141 study that compared nivolumab to standard of care single-agent treatment in patients who were platinum refractory. Platinum refractoriness in that study was defined in two ways. Either patients who were treated with platinum in the locally advanced setting and then progressed within 6 months of curative intent therapy, or patients who had had platinum in the first line recurrent metastatic setting and then progressed. Those two major cohorts were included, and the comparator was single agent, either methotrexate, docetaxel, or cetuximab, according to investigator choice. What we saw in Checkmate 141 was a doubling of 1 year survival from about 17% in the control arm to 36% in the nivolumab arm. We saw an increase in response rate. Response rate with nivolumab was about 13%. And also importantly, we saw a much better toxicity profile with 13% grade 3-4 adverse events with nivolumab compared to about 40% on the single agent standard therapy, either chemotherapy or cetuximab. And based on those data, nivolumab was then approved for patients with recurrent metastatic head and neck cancer who were platinum refractory.
The availability of checkpoint inhibitors has radically changed the landscape of standard of care treatment of recurrent metastatic head and neck cancer. Previously, the standard of care was a platinum doublet plus cetuximab, followed by a second-line cytotoxic agent. There were two major weaknesses to those second-line agents. They didn't work, and they were very toxic, but otherwise they were great. So this is really a revolution in that we have a totally new mechanism of action that is less toxic, that actually works, and it actually works in a way that's very meaningful to patients' values. Patients don't come into the office saying, I want this new, better therapy. My hope is that you can add 3.5 weeks to my life on the average. Patients come in and say, please give me a chance at being alive in a year for my daughter's wedding. Please give me a chance at being alive in 2 years to see my first grandchild born, or whatever it is that's important to that individual patient. This is the first class of agents ever in head and neck cancer that allows us to offer the patients a legitimate chance at that, and we can do it without beating them up in the process.